What is EmpowerMD and how is it different from a traditional doctor's office?
So EmpowerMD is different. It's a direct primary care, and we're essentially just taking out the insurance from primary care. So we're taking out that middleman. It's a monthly membership, so you pay a monthly, in this case, $79 a month, to get unlimited access, which includes chronic visits, preventive, acute, urgent. Any of those things will be included with that membership.
Okay, so to be clear, this is not health insurance.
Yes, that's a good question because they keep asking. No, it's not a health insurance, but it is a membership for primary care.
Okay, great.
Mhm.
So SISD now offers that CDP plan. Can you explain why pairing that consumer-driven plan with your EmpowerMD membership is becoming the most cost-effective choice for employees that you've recently signed up to your membership?
Yes, so what we're encountering is that the traditional or the copay plan that SISD is offering is really expensive. And so the consumer driven is available to the employees for $0. And so you're essentially not paying for that health insurance. Um, and SISD will be giving you $1,200 in HSA funds. Those HSA funds can pay your monthly membership fee here with us at EmpowerMD. And so it basically covers all of your primary care, what we just talked about, and you still have that high deductible insurance for emergencies or for anything that may happen throughout the year.
Okay, so it's not only better, the care is not only better, it's also less expensive, right? So if I'm an SISD employee and I go get the CDP,
Mm-hmm.
right? As just as an employee, for example, I'm going to pay $0,
Mm-hmm.
correct?
Correct.
And they're going to give me $1,200 in my HSA card that can now be used to pay the full year with your membership.
Exactly. And I think you even still have some money for other things as well.
Right. So 1,200, your
Mm-hmm.
membership is
Mm-hmm.
about 1,000.
Mm-hmm.
So they're keeping $200 in their pocket.
Exactly.
Okay. So essentially, their health care
It's
would be free.
free.
Their primary care would be free if SISD explained to them that that's how the CDP plan works. Great.
Exactly.
All right. So can you share a simple example of how this works for a teacher? Right. So I just kind of gave you mine if I were an SISD, but let me break it down. Right. So what we found is that copay plan premiums for just an employee is $282 per month.
Okay.
The CDP premium is $0 per month.
Mm-hmm.
Your EmpowerMD membership, just for one person, is $79 per month.
Exactly.
So what you're telling me is instead of paying almost $300 a month in premiums plus copays,
Mm-hmm.
they would only pay $79 and get unlimited care. So that's a savings of more than $2,400 per year.
Mm-hmm.
Plus they get $1,200. So you add the $2,400 plus the $1,200 in HSA. That's how much they're saving.
Exactly.
And you take care of the primary care, unlimited visits,
Unlimited visits all
unlimited
year. Anything
women's
you need,
health.
women's health, urgent care. Instead of going to an urgent care across the street, you come here, and we get everything. Everything is included.
Included.
Exactly.
All right. All right. So, Doc, what about family? What if they have kids they want to add?
So in my membership, you can add children if they're under 18. It is $49 a month, and so you just add that to the membership family plan. If you want them to be under the consumer driven, I believe there's also an option there with SISD. So you would have to consider and see what is the best choice for you in your family.
Okay. So, as we read on your website, a family of four membership with you is $237. That includes two adults and two children from ages of 4 to 17.
Exactly.
And here's a really important question, right? And I think one you got earlier. What if I just want to include myself with the CDP plan because that would cover, I think, my entire primary care for free? Can I just add the kids along with me to your membership?
Exactly. Yes.
Gotcha.
So you can separate if you don't need that high deductible consumer driven for your children, and you just get it for yourself for $0, you still will get the 1,200 to kind of pay for the monthly membership, and you can enroll your 2 children into my plan and know that all of their primary care needs will be included.
Okay, so if your child wakes up sick before school, can they
Mm-hmm.
text you directly? And can you see them that day? Or what if they don't want to come in? Can you see them with telehealth or even texting you to your
Mm-hmm.
HIPAA certified account?
Exactly. And that's the beauty of what I'm doing here in direct primary care is that you will have that access to me. You can call me if he's vomiting, he or she are vomiting and can't come into the office. We can do a televisit. We can send meds, see if that helps before we have to bring them in. So it includes everything.
Okay. All right, Doc. So, last question.
Okay.
What do you want SISD employees to know as they choose their plan this year? And I know it's coming up on them quick. And I know we're doing this video because you are being bombarded with phone calls, which
Which is
you
great.
love, right? Because you take the time to explain. And I think they need to know that you're answering the phone call.
Mm-hmm.
You're talking to them, right? That's the relationship based care that you are bringing to El Paso. So, what do you want them to know? What do they deserve in healthcare?
I think what I want them to know is that there are options. I think for a long time, many employees, many patients feel that there's just the traditional model of insurance and that's what you have to do and pay your copays and meet your deductibles. But this is something that is completely different, that is bringing back that relationship-based care with my patients, that I can truly connect with them and really just be there for them for anything that they may need. And SISD actually is making it pretty convenient when adding that consumer-driven healthcare plan. They just didn't have a plan for the primary care part, and that's where I would come in and include all of that primary care for them for that monthly membership price.
That's awesome.
Mm-hmm.
So I know you had one more question. At least somebody reached out to me that's a friend of mine that works at SISD. I don't think they're aware that if they are on the CDP plan,
Mm-hmm.
that if they go to the county care system that the SISD went with, that they can not see them for $10. That they're going to charge them by law $150 every
Exactly.
visit.
So it'll be, and that goes with any primary care that they see. If they do choose the consumer driven plan and they don't come with EmpowerMD, they'll have to go seek healthcare with another PCP in the city. It will have to be full price until you meet the deductible. So everything will be full price. The cost of the visit, you can get after costs, you can get the cost of the labs, all until you meet that deductible of $4,000.
Okay. And again, with you, there are no deductibles, there are
No
no
copays.
copays,
Mm-hmm.
there are no hidden fees.
Exactly.
That flat fee covers unlimited healthcare.
Very transparent, very just relationship based care.
Okay. And also, one of my friends that reached out,
Mm-hmm.
do you do GLP-1s, right? I know that's a very hot topic and weight
Mm-hmm.
loss is very important. I know you have very important views of how you treat patients and the medical science behind it, right? Will you be doing programs that educate people more on how that works and what you do different than some infusion places out there concocting their own cocktails of medicines? I think we need to let people know that's not something that you do, but that you do know how to manage weight loss and obesity. And with you, tell me more about it, right?
Yeah.
How do you do that?
So absolutely. We started this also in SISD, but what I'm doing here is weight loss, and it's not just giving a medication. It encompasses so much. We have to get a good health history. We have to get initial labs, make sure that everything is okay to even start a medication like that. It is a diagnosis that has to be treated in a certain way. This is medical care. It shouldn't be just a fad or something that's going around. And so we do it responsibly. You have to make sure you don't have contraindications. There are contraindications for GLP-1s. Not everyone can be a candidate for it. And so these are things that we would go in detail about. We can measure the composition, your body composition, make sure that you're losing it correctly, that you're not losing too much muscle. Those are all things that are going to be incorporated into the weight loss program here, along with a diary, access to just education, just dietitians, all of those things. So we do a comprehensive, evaluation for weight loss, which is the way that it should be.
Okay, great. Well, I think that's it.
Mhm.
Thank you, Dr. Nevarez, and thank you to our SISD teachers and staff that have reached out.
Yes,
I
thank
know
you so
you've gotten
much.
an influx, and we'll put this out there. And if people have questions, they can reach you at what number?
Oh, it's 915-235-3768.
Okay, and again, who does that number go to, doctor?
That goes straight to my cell phone, so I'll be the one answering. If I don't answer, please feel free to leave a message, and I will give you a call back.
All right, thank you, doc.
Thank you so much.